ProAct is a technology-enabled provider of chronic disease care. Its iSync system represents the future of condition management with innovative clinical protocols, process flows, and inter-provider communications. ProAct is dedicated to providing a total solution to patients with obstructive sleep apnea, or OSA. Left untreated, OSA can be a killer. Consider the association with the following cardiovascular conditions. 91% of nighttime heart attack patients have OSA. Studies show the risk of myocardial infarction is 23 times higher in OSA patients compared to about 11 times higher in smokers, 8 times higher in hypertensive patients, and 7 times higher in patients who are overweight. 80% of people with drug-resistant hypertension have obstructive sleep apnea. Patients with moderate to severe OSA are 3 times more likely to have a stroke over the next 4 years. And 77% of those experiencing ischemic stroke have OSA. 76% of those with congestive heart failure have OSA. Treating OSA improves cardiac output. 59% of patients with cardiac arrhythmia and 49% with atrial fibrillation have OSA. Treatment of OSA reduces the chance of recurrent atrial fibrillation and arrhythmias. 35% of those with hypertension have OSA. Evidence shows that treating OSA can reduce hypertension or prevent it from progressing. OSA is closely associated with a number of other serious medical conditions. The metabolic impact of OSA can contribute to weight gain, so it's not surprising that 77% of people with a body mass index greater than 30 have OSA. Many who are treated lose weight. OSA also increases insulin resistance, and 72% of those with type 2 diabetes have OSA. A study from UCLA shows that obstructive sleep apnea patients are 3 times as likely to develop diabetes. There are also recent studies linking OSA to erectile dysfunction, GERD, even cancer and Alzheimer's disease. Last, OSA is a large contributor to motor vehicle and workplace accidents. Motor vehicle accidents are more than 2.5 times as likely for people having OSA. Only 15% of OSA patients have been diagnosed, leaving 85% or 30 to 40 million in need of care. So the OSA continuum of care must start with broad-based population screening to identify those in need of care. It continues through testing, diagnosis, treatment, and ongoing compliance management. ProAct optimizes condition management by integrating the total continuum of care within modern clinically documented protocols. ProAct is uniquely organized to manage the continuum of care with a sleep testing division, independent certified sleep specialists, an accredited health network providing oral appliance therapy, and a DME division providing positive airway pressure therapy. ProAct's iSync IT platform creates a virtual delivery infrastructure that enables multiple providers to manage a patient through all or part of the continuum of care in a coordinated manner. Designed to automate the entire patient and provider experience, the system represents the future of condition management with state-of-the-art clinical protocols, process flows, and inter-provider coordination made possible by the shared OSA medical record. With the iSync system, providers are always in the loop as their patients progress through the continuum of care. Using ProAct's iSync system, screening can be completed in many settings: doctors and dentists' waiting rooms, wellness programs, and even web surveys. Practice screening results are immediately scanned into the iSync system for immediate scoring, which is over 90% predictive. If the patient is positive, the iSync system verifies the patient's insurance coverage and payment responsibility for a home sleep test, so that information is available to the provider during the consultation. For positive screens, the doctor uses an iSync tablet to discuss the results with the patient and makes a final assessment. If a home sleep test is required, the patient's copay and deductible status can be viewed on the tablet, and the doctor can e-prescribe and schedule the test directly from the tablet. Because patient information is contained in the iSync medical record, no further information needs to be entered. ProAct Sleep Testing Division can process the order. A home sleep test will be mailed to the patient's home, arriving on the day of the scheduled test. The patient sleeps wearing the device for 2 nights in the comfort and privacy of their own bed. It is simple to use and comfortable, so highly representative data is recorded. After the second night, the device is mailed back in the same package using the prepaid self-addressed envelope enclosed. ProAct uploads the captured data into the iSync system for review by an independent certified sleep physician. A sleep specialist makes the diagnosis, determines the severity, and makes a treatment recommendation in a report that is posted on the ordering doctor's iSync portal for review with the patient. If the patient is one of the 70 to 80% for whom oral appliance therapy is indicated, the physician selects a health network dentist and e-prescribes oral appliance therapy. Again, since all providers are viewing the same iSync medical record, no file transfer is required. The information is immediately available for the patient's dental visit. The referring physician is able to review patient's record at any time, including efficacy pulse oximetry and home sleep test results used by the dentist to determine requirements for appliance adjustments. If the patient's OSA has progressed to a severe level, the provider may use the iSync system to e-prescribe a CPAP, which is managed by ProAct's DME division. Compliance is a well-known complication with OSA therapy, particularly with CPAP therapy. The iSync system is designed with the tools to monitor, manage, and report compliance to the referring doctors. For example, if a CPAP patient becomes non-compliant, even with ProAct's follow-up efforts, the referring physician can see the patient's status on the iSync system has changed to CPAP intolerant. The patient can then be redirected to oral appliance therapy rather than cease treatment. If you are a patient, provider, or payer and want more information on how ProAct can help you, visit ProActHealthSolutions.com. Thank you.